Thank you so much for being here with us today, Marian. It's really, really great to see you as always. Could you just start off by giving us a bit of background about your skills, your areas of interest?
Thank you for having me, first of all. So I'm Dr. Marian Khatib. I'm an oncoplastic breast surgeon, and I'm currently the director of breast surgery at the American Hospital here in Dubai.
And Marian, so what was it that made you decide to relocate, and what specifically drew you to Dubai and UAE?
It's a difficult question, not an easy one.
Yeah.
It was a combination of many things all together. First of all, personal life. I've been hearing a lot about Dubai recently, and also professionally about the healthcare sector in Dubai. The fact that you can do a lot and advance the healthcare, can contribute to move things in this place, attracted me a lot and made me consider that big step.
Yeah, I mean, Dubai, UAE is one of the most progressive countries in the world today. And I think, yeah, it does attract certain individuals like yourself, you know, very high caliber, hardworking, successful people that wants to come here and contribute to help build the infrastructure, which is growing rapidly. So, yeah, no, it's really great to have you here.
So I think the main difference, even having worked in robust healthcare systems before, the difference here that you feel that you can affect the process. You can do something that has an effect on the healthcare system.
Yes.
While in other places you feel like a little screw in a big system.
Yes.
And it's not the same.
Yeah.
It's completely different.
You really can make impact here, make a big difference.
Mm-hmm.
Wow, I love that. And how has your experience been so far working at the American Hospital in Dubai?
Amazing. So it's not easy to be an well-established professional and then leave everything behind and start from scratch.
Of course.
But it has its own challenges. But I feel lucky I came to a place like the American Hospital. Really, the team, the institution, the support that I'm getting from everyone around me, from the management, is priceless.
And what aspects of your previous experience and background would you say are contributing, especially for your leadership role here in Dubai?
So having a lot of experience in the oncoplastic breast surgery field itself as a surgeon,
Yes.
I think it helps. But also I held the position of being a director of a big cancer center before. So being in a place where I am today is not a big challenge for me because I'm used to this role. In addition of having an MBA in healthcare innovation, I feel that thing helped me a lot in trying to integrate innovations into traditional care, not only in terms of the management role, but also always looking to bring new things that are like in different parts of the world, to try to bring the best care to the patients that I'm treating here in the Middle East. And that helps also to do connections with people around the world, be it in Europe, in the States, everywhere. So I think networking in medicine is very important, and we doctors, we can always learn from each other. No matter how experienced you are, I think you can never stop learning. You should always aspire to learn more and more in your field and in other fields as well.
Yeah, I think you do. You have a huge network, actually, a huge global professional network, because I posted a picture with you and I posted it on my page, and then literally that post got so much traction, and so many of your colleagues were commenting like how much they appreciate you, and you're very highly respected in your field. That's when I really felt it. I was
Thank you.
Wow, this lady's actually very famous.
Thank you.
Yeah, honestly, because I've known you for a long time now, and you know, we was working very well together. And one of the things I always say about you is that you're so humble.
Thank you.
Like, even though you've got such a strong background and you're very successful, you've achieved a lot in your career, and you're very well respected, but at the same time, you're so humble. And that's when I really felt it, you know, when I saw how many people respect you and know you globally, internationally. Yeah.
I think many people were surprised from this step, from my decision to move to the UAE.
Yeah.
Because like I was in a good place, and it's not that I've been in that place for long. I was still doing things, still changing, and I was successful in in what I was doing. So it was very surprising for many people that I decided to do that step.
Yeah.
And I'm still, until today, getting many phone calls, many messages from everyone. So what made you do that? What made you?
Yeah.
And some of them say it's crazy. Some of them say it's brave. But I'm happy. I'm happy I made that decision, to be honest.
Yeah, it was very difficult, and it is. And I think the more successful you are and the more you've achieved, the more difficult it is to let go, isn't it? And start again. And
definitely.
It's not easy at all, but you just followed your heart, your intuition, and you just did it anyway, even though you felt so uncomfortable. And I think that has impacted a lot of people, and I think you've inspired a lot of people, actually, because I think there's a lot of doctors in the same situation, you know, that they want to come to this region because of all the progression taking place, but it's a very uncomfortable decision. And I think when someone like you makes that decision, it really inspires a lot of people. So that's really amazing.
You're absolutely right. It's different between if you make such a decision in a different stage in your career. For example, when I went on for my fellowship in the UK, it wasn't a hard decision at all. Like, I didn't even think. I went, I didn't know even what I was going for. I just packed everything, moved my family and went there. But now it's different.
Yes.
Like when you, as you said.
At this level.
Yeah.
So does your surgical practice, you know, the patients that you see, the conditions that you treat, does that differ significantly compared to previous workplaces you've experienced?
Not really. You know, Dubai is a very multicultural city. It's not that you see same kind of patients. You see patients from all around the world. You see different cultures. There are some women who come just to be routinely checked, which is recommended.
Yes.
And many others, they never check routinely, only if they have symptoms and only after it's advanced symptoms that they come to be checked. So it's very variable. I was contacted, by the way, you just reminded me, by someone from back home who wanted to do research about the cultural differences between certain country and this country. And I said, you can't treat Dubai as a unicultural country. It's like you can find all the cultures here, all the nationalities, different mentalities, different cultures.
Yeah.
So it's not a unified.
Yes,
Yeah.
yes, I understand. It would be difficult to pinpoint, isn't it? Because it's just so variable, over 200 nationalities here. So I can understand that. Could you just tell us a little bit more about the importance of early screening for breast cancer?
It's very, very, very important. I can't stress how important it is because there's a huge difference between early diagnosis and late diagnosis in breast cancer.
Yeah.
When there's an early diagnosis, the chances of curable disease exceed the 90%.
Wow.
And we're talking about a cure without recurrence of the disease, where if you diagnose a patient with an advanced stage, then it's a completely different story.
Yes.
So it's one of the diseases that early diagnosis is highly, highly important, unlike other cancers, because breast cancer can be easily treated. I always say that, and it's important that's why I said that it's very important to get routinely checked without having any symptoms, just to check routinely, because if it's diagnosed early, women can be treated and can continue their lives afterwards as if nothing happened, even, we can say.
Yes. And what age group do you recommend people to come and see you?
Starting from the age of 25.
Okay.
Many people find it very strange because 25 is quite a young age, but yes, it's very important to come for at least one consultation at the age of 25 to see, because follow-up should be different for different groups of people. Not all people have the same risk for breast cancer.
Right.
So this risk should be assessed by a breast surgeon, and then we will decide the right way of screening. So it's very important to see a breast surgeon at the age of 25 and decide what's the right way of follow-up and routine screening.
So as you've mentioned, you have a strong interest in surgical innovation. And I know recently you started the robotic services at the American Hospital for mastectomy. So could you just tell us a little bit more about that?
Yeah, it's important to say that it's a little step in a big field. Yeah, not all breast operations would be suitable for robotic operation. It's used usually for mastectomy and reconstruction, and in certain patients, not all patients. But I believe that we should use the technology to help us and advance the treatment that we give to our patients. So robotic surgery is one of them. In robotic surgery, you can do an operation, a huge operation in terms of breast, which is excision, removal of both breasts with immediate reconstruction, with very small incisions that can be far away from the site of surgery, which minimizes the risk of ischemia, of infection, and reduces the risk of implant loss. But again, it's not suitable for all patients, and it's just a very little area of the whole oncoplastic and reconstructive breast surgery.
And could you just tell us a little bit more, Marian, about what is the importance of having the specific training for the onco breast surgery in your field?
So as we said, these days the cure from breast cancer is very high. So the importance of the aesthetic outcome is quite significant. Not only removing the tumor and curing the patient, because this patient is going to live with her body, with her image for long years, and it's very important how she sees herself in the mirror afterwards. Yes. So oncoplastic breast surgery integrates techniques from the plastic surgery in order to enable us to remove very large tumors in some cases and leave the breast in a very aesthetic shape. For example, tumors that once they did a mastectomy for, removal of the whole breast, these days we can remove them and we can still get a very aesthetic breast at the end of the operation. And I think when you have one doctor that can see both sides, the oncological side and the aesthetic part, it's something that can be priceless, because many things can fall in the middle when you have to look for doctors from different specialties, to have one doctor to remove the tumor, another doctor to do the reconstruction. It's not the same as when you have one doctor that you trust and can see the whole picture as a whole.
And how was your experience working with Allocation Assist?
Amazing. I think we matched each other very well, because you were exactly what I'm looking for. I wasn't stressed looking for a job, and it's just... I remember you telling me, thank you for trusting the process, but it's just our temper just went very well with each other. Like I just went with what you told me and did everything what you told me. And you know, I did only one interview. It's not that I interviewed or... I remember the first day you called me, you told me the American hospital are looking for a breast surgeon. Yeah. They want to interview you tomorrow. And yeah, the rest is history.
Yeah. No, we always got on really well together. And I've always sort of felt like you're like my friend as well as my client, and it's been so nice working with you. Thank you so much.
Thank you. Same for me.